It is my pleasure to introduce our speakers for the discussion today. We have Dr. Kyle Hill, who is an assistant professor of Indigenous health at the School of Medicine and Health Sciences at the University of North Dakota. We also have Lily Gelb, who is a student leader with Schools for Climate Action, as well as Dr. Pamela Pugh over at the Chisholm Legacy Project, where she is the Chief Programs Officer. And we also have lawyer Irene Burga, who is the Climate Justice and Clean Air Program Director at GreenLatinos. Thank you all for joining us today. And I'd like to go ahead and let our panelists introduce themselves and share a little about the work that they do. So let's go ahead and start with Lily. I'll hand off the mic to you.
Hi, my name is Lily. I'm a junior in high school and I'm turning 16 years old next week. Today, I'm representing Schools for Climate Action, a youth-led climate advocacy organization working to center the voices of students and teachers in climate policy. First, I want to say that I'm so thankful to the Lancet Countdown for including a student perspective on this panel, because we know that youth will be the most impacted by the climate policies put in place today. For instance, the implementation of the Inflation Reduction Act will greatly influence the future that I will experience. While more work needs to be done, seeing this historic investment into climate solutions brings me hope. In Sonoma County, where I live, students have suffered repeated climate-related wildfires while also struggling through the pandemic for the past few years. We watched as continued roadblocks prevented Congress from acting on climate change. This impacted our physical health through the extreme air pollution from the smoke, as well as our mental and emotional health from both the disasters themselves and the fear for our future, given the lack of a response from political leaders. In response, we marched, we wrote letters, we organized, and we joined together across state lines to call on Congress to address the climate crisis. Schools for Climate Action is based in Santa Rosa, California, 1 hour outside of San Francisco. We were founded 5 years ago by a volunteer group of teachers and students. Our first project was helping to mentor students across the country to pass climate action resolutions in their school districts. We now have over 85 school board resolutions across the country. Additionally, in the past 5 years, Schools for Climate Action students have written and passed a climate emergency declaration in California and also authored 2 federal House resolutions. HRES 29, supporting the teaching of climate change in schools, and HRES 975, expressing the mental health impacts of recurrent climate-related disasters on youth. At the end of last month, 5 members of our group traveled to Washington, D.C. to lobby for HRES 975, which was written by 2 students in our group. While we were there, we organized meetings with 70 congressional offices, attended advocacy meetings with the Medical Society Consortium on Climate and Health, trained 60 8th graders in advocacy, hosted an 80-person lobby day with the 8th grade class, and spoke at a press conference about HRES 975 along 4 congressional members. While we were in DC, we recognized that many congressional offices had not made the connection between mental health and climate change, and we are proud that HRES 975 is the first piece of congressional legislation that links the 2 issues. Thank you.
Thanks so much, Lily, for sharing. Dr. Hill.
Yeah, hi, good morning or afternoon, wherever you're at. My name's Kyle Hill. I'm enrolled in the Turtle Mountain Band of Ojibwe in North Dakota, and lineal descendant of the Sisseton-Wahpeton, Oyate, and Cheyenne River Sioux tribes, both in South Dakota. As they said before, I'm an assistant professor in the Department of Indigenous Health at the School of Medicine at the University of North Dakota. And in that program, I do research primarily on the intersection of health equity and climate change and planetary health with Indigenous communities. But also I teach social and ecological determinants of Indigenous health policy and public health programming. And so excited to be here with everyone. And I just want to appreciate the centering of environmental and climate justice in the Lancet policy brief. And right now, one of the biggest issues I see for Indigenous communities is the considering, when we talk about the land back movement, we want to center and facilitate discussion and certainly like a reparative framework around developing some way for us to revitalize our Indigenous traditional ecological knowledges, but also recognize that that's rooted within our traditional territories and homelands. And so we understand right now that Indigenous communities protect about 80% of the world's biodiversity, yet only make up about 5% of the world's population. And we might only, occupy or be on about 20% of the world's surface. And so as important as that is, to protect biodiversity, we lean heavily on our Indigenous traditional ecological knowledges. And that's really just a way of saying like our life way. This is a way of living. These are our cultures, these are our traditions, these are our spirituality. And it happens to be place-based, collective, and holistic in nature. And so then when we also recognize a more recent investigation that noted the results of that were that we've lost about 99% of coextensive historic homelands and territories, and displaced by as much as 200 to 300 kilometers on average, our tribal and our Indigenous communities have in North America. And in particular, I want to say that report was for American Indian Alaska Natives. But we have to ask ourselves then, like, how do we respond to the calls for climate justice? What does that mean? The justice aspect of that. And I think, some of the pieces of the climate policy, the Lancet report addressed that quite well. At the same time, I think there is certainly a need to be able to identify not only the risk factors and the vulnerabilities of Indigenous communities and other communities of color, but also the ways that the Inflation Reduction Act stands to alleviate those vulnerabilities, and also appropriately resource Indigenous communities in particular to be able to revitalize and reclaim and utilize those Indigenous traditional ecological knowledges again. So I just, again, want to say thank you. I appreciate this opportunity to share space with everybody. And, we're in this together. So appreciate it, and wonderful comments so far. Thank you.
Thanks so much, Dr. Hill. Dr. Pugh.
Mm-hmm.
Good afternoon, morning, or evening, wherever you are. Yes, there have been great comments so far by Lily and Dr. Hill. I am Pamela Pugh, and I have the privilege of serving as the Chief Programs Officers for the Chisholm Legacy Project. And I probably almost pick up from where Lily left off. And when I was thinking about coming here, I was thinking about the NAEP scores that were released yesterday. Those are scores that are often referred to as the nation's report card and allow states to look at how they're doing from year to year on test scores. And so though, many of us were not surprised that disruption in education due to COVID-19 or the high rates of illness and death, and even children being orphaned at an unprecedented rate would impact those academic scores across schools in our nation. I think what is most intriguing to me is that we still look at these factors separately and singularly, without thinking about the environmental and the climate injustices, as well as the environmental injustices that many of these children are exposed to. I think about the city of Detroit, which unfortunately receives national news. And again, we're talking about academic performance, but we also have to think about the fact that these are post COVID-19 numbers compared to pre-COVID-19. But we also think about the fact that this was an epicenter for COVID-19. This was an epicenter before that for asthma rates for children. And before that, there were those of us screaming about the polluting factors that lead to asthma that then is a leading factor or a leading cause of school absenteeism. So what I really am looking forward to is this report really driving home the point that we, number one, have to prioritize children. And we know we're talking about, most importantly, BIPOC children and children living in low income communities, those children who are most impacted by environmental injustices and our frontline communities, and making sure that we are doing whatever we can do to improve those conditions in those neighborhoods, and making sure that it's that all that we do is centered around addressing the drivers of climate change. But really, when we're hearing these mainstream media stories, that we're able to put the whole picture together and not leaving these factors out. And so I look forward to the conversation, as well as where this report can help to carry the conversation, as well as the Inflation Reduction Act funding can help to lead these various pieces to come together.
Thank you so much, Dr. Pugh. Irene.
Hi, and thanks so much for having me. So for my intro, I was asked to describe why I'm interested in climate, health, and equity. And so I just wanted to share a little bit of my background. My first connection with and to the environment was spending summers as a little girl in the Andes Mountains in Peru, where my father's from. And I'm a proud immigrant hailing from Spain and Peru, and I was raised in occupied Chumash and Tongva territory, today what's known as Los Angeles, where I immigrated to when I was 8 years old, which was another incredibly formative experience. LA is where I was first exposed to serious air pollution, and living in a mostly Latino industrial part of the county with two major freeways, heavy truck traffic, moving cargo to and from the ports and oil and gas fields nearby. And it wasn't until college that I learned about the term environmental justice and started making the connection between the illnesses many of my friends and families experienced, like asthma, and the location of where we lived and the exposure to sources of pollution. So this background deeply shaped, my career trajectory and my kind of interest in this topic, really kind of by necessity. So now, as the director of climate justice and clean air for GreenLatinos, I get to represent my comunidad Latina. We work on climate and clean air issues that directly affect our familias. GreenLatinos is an active comunidad of Latino leaders emboldened by the power and wisdom of our culture, united to demand and dismantle racism, resourced to win our environmental conservation and climate justice battles, and driven to secure our political, economic, cultural, and environmental liberation. And we really envision a healthy and equitable society where communities of color are liberated from disproportionate environmental burdens, are free to breathe fresh air, drink pure water, and access clean transportation. And that's why 2 weeks ago, I want to talk about something that we launched. We, along with 22 partners, launched the Latino Climate Justice Framework, or LCJF for short. And this is a new report highlighting the issues disproportionately affecting our Latino community and providing a blueprint for an equitable future. Many of the points in our report are supported by the Lancet brief launched today, and I'm very happy to see kind of additional resources and research that's really needed out there. And the historic movement that we've launched with the Latino Climate Justice Framework is the culmination of a year-long process to co-create with Latinx serving organizations a lasting framework for addressing the climate crisis that prioritizes environmental justice and elevates Latinx priorities. The framework that's presented in this report builds upon the significant work of frontline climate and environmental justice leaders to elevate our unique burdens. So just to give y'all a taste, the report includes everything from air and water pollution in our communities to climate migration, to language access issues, to farm worker rights, and bringing resources and justice to Puerto Rico. And this framework was developed really to help our partners and families and friends and decision makers to stand together to fight for environmental liberation at this critical time. The Latino community is resilient, but in developing the LCJF, we are recognizing that our communities are suffering and the time to act is now. And I'm very, very excited to see where the points of alignment are between the Lancet brief and the LCJF, and I'm looking forward to the discussion. Thanks.
Thanks so much, Irene. Looking forward to jumping into our discussion on ensuring health and equity in implementation of the Inflation Reduction Act and Infrastructure Act. As a reporter covering health and environmental inequities at USA Today, I'd like to first pose some specific questions to each of you on that very topic. So let's go ahead and start with Dr. Hill. Dr. Hill, you were an author of the World Health Organization's policy brief on mental health and climate change. Can you talk about this often overlooked consequence of climate change and what these funds can mean for mental health equity in tribal communities who have experienced repercussions of heavy industry extraction and other climate and environmental injustices?
Yeah, sure. I think, first and foremost, we recognize that there is, intersection of health equity and climate, environmental justice efforts. And so, I think what often gets overlooked is the mental health challenges posed by this. And so within Indigenous communities, a lot of my work is, of course, at the intersection of health equity and climate change. But really, when a little bit more in depth, it's a lot about mental health. Like in my background, I'm trained as a psychologist. So I get my PhD in clinical psychology, went back for my MPH. And so recognizing this kind of disparity, we talk a lot about physical health, but with respect to Indigenous communities, the biggest issue that we grapple with is historical loss, which is essentially colonial subjugation for, from our tribal communities. I had mentioned earlier, the biggest thing that stands out for us is the land dispossession with, again, like near complete land dispossession. Again, I said 99%, and a lot of people had mentioned that, but the number really didn't come to fruition until a more recent investigation in the past couple of years. And so it really helps us understand just the comprehensive nature of the, colonial project, the architecture of this. And for the most part, with respect to climate justice and environmental justice, we have to recognize that all of our, traditional lifeways organize around our access, number one, and ability to utilize our land, number two. And that's being challenged right now at rates that, are pretty incomprehensible. But I think our generations before me would say that it was worse back then, right? So in American Indians we weren't allowed to practice our religions or spiritualities until 1978 with the American Indian Religious Freedom Act. We weren't recognized as citizens until 1924. And so even in our own territories, communities, we weren't recognized as one, belonging, but two, not able to engage these traditional lifeways that recently the federal government actually elevated as central to implementing adaptive and mitigation activities across the U.S., certainly globally. And so these knowledge systems are not only place-based, but they're organized around, again, indigenous epistemologies and ontologies that have served us time immemorial. And so the original stewards of the land, the caretakers, it's important that we're part of this, actively, and obviously partnering with Western science. And sometimes we would call that, a two-eyed seeing approach. But yeah, I definitely think, the Inflation Reduction Act is helpful in a sense, like it provides the Bureau of Indian Affairs with tribal block grants. There's a lot of community-oriented objectives and resources being filtered through the Bureau of Indian Affairs, through tribal communities, and also a lot of Indigenous community members or a lot of American Indian Alaska Natives are make their homes in urban communities. Like for myself, I lived in our ancestral homelands of St. Paul and Minneapolis, Minnesota as a Dakota person. And I can say for us, having tax credits for things like, small things, just to make our homes a little bit more resource and energy efficient, whether that's a induction cooktop or whether that's, changing, being able to get energy efficient windows, other appliances, insulation, that's all important. And I think it does leave, though, some big questions too about how as a community do we meet some of these some of the issues that we still have, the risks, the injustices. We know that Manchin had a side deal with the Inflation Reduction Act that was also quite problematic until it was withdrawn at the last minute. And so that provided subsidies again for oil and gas leases, which we recognize is the most harmful of any of the risks of climate. And so I think, and when we look at even going back 2016 in Standing Rock, we've had mining issues of copper up here in the Great Lakes, which is the largest freshwater lakes in the world. And so we see these risks that are near and dear and close to Indigenous communities and our land bases that hold our traditional knowledges. So there's just so much going on right now. And I think the Inflation Reduction Act is huge in its potential. And I hope that we're able to scale up these solutions. And again, as we've mentioned before, help kind of steward this just transition. And I hope that Indigenous communities of course, we're on the front lines, but we also need to be on the front lines of change at the tables to be able to make decisions. So I hope that answers the question. There's just a lot there, but I appreciate the opportunity. Yeah.
Absolutely. Thank you so much, Dr. Hill,
Yep.
for your insight.
Mm-hmm.
And Lily, would you mind sharing, what would you like to see, these federal dollars spent on in your community to make it a healthier and more equitable place to live?
Yeah, so as I mentioned, I live in Sonoma County, California. In October 2017, my community endured the Tubbs firestorm. Many of my friends and classmates lost their homes and all of their possessions, fleeing their homes in the middle of the night. Those of us who were more lucky were evacuated from our homes for over 2 weeks as our communities were surrounded by flames and unbreathable air. This experience led members of Schools for Climate Action to write HRES 975, the first piece of federal legislation to acknowledge the connection between youth mental health and the climate crisis. We believe that it's important for Congress to address this issue, which students are already aware of and experiencing. Many young people in my community feel symptoms of PTSD during large windstorms because it reminds us of the night the Tubbs fire started. Many kids also have a heightened sense of anxiety when they smell smoke, even barbecue smoke or smoke from the frequent controlled burns in our area. Therefore, alongside providing money for wildfire recovery and resiliency, we would like to see IRA funds used to provide long-term mental health resources to communities on the front lines of the climate crisis, because mental health care is a critical aspect of disaster preparation, disaster response, and climate resiliency.
Lily, thank you. I'd like to go over to Irene next. Irene, when it comes specifically to Latino communities and the specific barriers they face when it comes to climate resilience, can you talk about how this federal money could help these communities and what it could miss?
Yeah, so for generations, Latinx communities have been at the front lines of environmental injustice, disproportionately exposed to toxic pollution from power plants, highways, ports, and other industrial facilities. We know that Latinos are significantly more likely to live in counties with unhealthy levels of particulate matter pollution in the US. So 48% of Latinos in the US live in counties that frequently violate ground level ozone standards. Latino and Black neighborhoods have also higher rates of unsafe water, and studies have shown that people of color on the whole are more vulnerable to wildfires. So, and just also another important thing is that Latinos are more likely and more represented to work outdoor construction or agriculture, where death rates from extreme heat exposure are higher for Latinos than for white non-Hispanics. And this is a critical piece that I think is also highlighted in the Lancet report. So I think the Inflation Reduction Act provides an extraordinary opportunity to advance long overdue investments in a resilient future that I think have been demanded by communities actually for a very, very long time. But we can only ensure that if we ensure that funding does not further entrench the status quo and further entrench our dependence on fossil fuels. So I'd say that there's good and bad parts to the IRA in our opinion. The investments of the IRA that do include provisions around clean air, clean transportation, drought response and preparedness, boosting community resiliency and used vehicles, the low-income electric vehicle tax credits are great. And these are all critical provisions for Latino communities. I'll also say that the provisions around making health coverage and prescription drugs more affordable are also critical for our communities. Now, the concerns were already highlighted by one of the other speakers previously, but along with the positive, there were significant trade-offs with fossil fuels and handouts given to fossil fuel industry. The IRA has provisions around requiring the Interior Department to make 2 million acres of our public lands and 60 million acres of offshore waters available for oil and gas leasing each year for a decade. We know that we're in a super climate crisis. We know that we have to slash emissions in half by 2030. And, the reports come out year after year, IPCC reports. So we know that we can't lock ourselves into more fossil fuel infrastructure build out over the next decade. It's just not workable. It's contrary to the latest science, and it's contrary to what we're experiencing already on the ground. And so I think that's why it's really important to oppose any sort of provisions like that. And that's something that we take very seriously and that our communities take very seriously. And any sort of side deals that will bring about more permit approvals for fossil fuel built infrastructure. So I'll stop there because of time limitations, but we can discuss more.
Thank you, Irene, for your insight. Much appreciated. Dr. Pugh, drawing on your public health background and your experiences working with the Flint, Michigan mayor to implement a health equity and policy approach during the water crisis, I'd like to ask you, how can local and state leaders keep environmental health equity in mind when implementing these funds?
Yeah, so, these are once in a generation type funding, and we know that these have to get to the communities that we are all here representing. And I think that this has been picked up on by all of my co-panelists. And so just making sure from the federal, starting at how the dollars will come out and make it to these states and local community will be key. Who will have control over those dollars? because one of the things that we saw in the city of Flint, if not the worst man-made crisis, one of the worst man-made crises, which would have been an $80 per day fix that turned into hundreds of millions of dollars, and still trying to fix that issue because there were people who just didn't feel like the lives in that community were worth that $80 a day. There was state takeover of that city. So first and foremost, making sure that those dollars get to the people who know those communities best. We have to have community-driven solutions. When we were working in the city of Flint, and any dollars that we received, we were trying our best to make sure that the residents most impacted would not only benefit from the health impact, but also from any economic benefit. So making sure that if there's economic opportunity there, those dollars must go to those local communities and the communities that look like those of us who are here represented on that panel. And so again, making sure that the decision makers at the local level and at the state level are getting those dollars directly to those communities most impacted, and making sure that how those dollars are spent are driven by them. So I won't necessarily put forward solutions, but I will say that they need to make sure that it gets to the hands of those and who will make sure that it is driven by those communities. We did so much. You talked about the health in all policies approach. Health equity in all policies approach means that any decision that's made, whether it was once we switched back or once we decided what Flint's long-term water distribution would be, no matter what that cost was, public health had to be first and the people's voice had to be first. That meant undoing disinvestment in that community. So for 14 years, our economic development department was down the street at the Chamber of Commerce, and we moved back into City Hall. That meant putting a public health advisor in City of Flint, who would then work with Department of Public Works, who would then work with the chief financial officer, who would then, all of those together and more, would be going out to community and making sure that community was determining how those dollars to undo the wrongs of that community were driven by that community. I'll just say one more thing is that we had the opportunity to bring in and put out the largest bid to a minority woman-owned business that was able to get a bid as a contractor when we were doing our pipe replacement. So my thoughts are those solutions be community designed, and that the community be at the forefront of driving those solutions, including economic opportunities from businesses down to youth, and education opportunities.
Thank you, Dr. Pugh. Really important points to keep an eye out for how these our funds are going to be implemented equitably. Yeah. I want to go ahead and turn it over to all of you for one question. I want to make sure that you all have a chance to answer this question. It looks like we've got 10 minutes left. So I wanted to go ahead and ask each of you, the IRA includes incentives, including tax credits and rebates, for homeowners who can invest in energy efficient appliances, including solar energy and moving to all electric, installing heat pumps. What does this mean for low income neighborhoods? How can local leaders guide and ensure low income families are not only aware of this opportunity, but can ensure that they benefit from this as well, and so that gap in opportunity is addressed? Dr. Pugh, we can start with you if you'd like.
Actually, one of the things that we were looking at in our community, and now through the IRA, we're seeing that there's even greater opportunity, was faith-based and nonprofit organizations, so that can benefit as well. And so when we've been voluntarily working with faith-based, having community anchors that can exemplify and be examples of what renewable energy and cleaner energy sources can look like, how they can be realized, how it can be job opportunities, how it can be educational opportunities, but getting greater awareness of communities first and foremost, and awareness of the opportunities that will be made available through the IRA for faith-based and nonprofit organizations, and for homeowners who are trusting of these institutions. And so that would be what I would offer first and foremost in this short amount of time.
Thank you, Dr. Pugh. Dr. Hill.
Yeah, I would just echo what Dr. Pugh said. I think, especially in the Minneapolis-St. Paul community, where there was relocation efforts in the federal government for American Indians to go to urban environments, but they were often left flat. So what we see is, or under-resourced, I would say, what we see in urban environments, a lot of American Indians who are well below the poverty line and often unhoused. And so I think that's the first challenge, is to be able to develop housing, low-income housing that can meet the needs of our unhoused communities, populations here in our cities. And I think that can in large part be driven, and the resources, are resourced, from our nonprofits. We have a lot of nonprofits that serve the community in a very good way. They're stable and they do it well, so trusting those nonprofits to funnel those funds and develop housing communities, affordable housing communities. And I think secondly, as she had already said, also is with those of us, very few, who are able to be homeowners ourselves, is to have some, I think, clear-cut language and opportunities that again could be driven by the local nonprofits, communities and organizations to push that out to us, right? And provide us those resources and opportunities pretty directly. And so in terms of our reservation communities, I think, nonprofits help there too, but also funneling those through their tribal governments, the tribal councils. And I think there's opportunities for that through the Bureau of Indian Affairs. So I appreciate the time.
Thank you, Dr. Hill. Lily.
Yeah, so first I want to say that yesterday, Schools for Climate Action spoke at a press conference with our congressman in our community, and that one of our students spoke in Spanish to help make the information that was being provided about the IRA more accessible to our community. And then also, it is clear in our community that incentives to use clean energy are too often only available to people with significant financial privilege. In our county, for instance, the power company provides incentives for households to use less electricity between 3 and 9 p.m. And for people who work full-time or multiple jobs, attend school, or have long commutes, these hours are not available to do things such as laundry. And I'd like to once again emphasize the importance of providing funds or incentives to school districts to implement clean energy infrastructure in communities. I believe that this is one of the most efficient ways to address inequities in access to climate solutions. Addressing the climate crisis on school campuses can help introduce the school employees, students, and families to simple, cost-efficient ways to implement environmental practices in other areas of their lives. As I mentioned earlier, one of the main areas that I focus on is climate education. I believe it is essential for climate education to be taught in a way that emphasizes systemic solutions to climate change instead of focusing on individual consumers, since consumer options are not accessible to everyone. Finally, I think the best way to ensure that environmental policies are just, equitable, and benefiting as many people as possible is to ensure that diverse voices are always present when creating climate policy. Thank you.
Thank you, Lily. Irene.
Yeah, so Black and Latino consumers pay higher utility bills while generally using less. I wanted to start off with some of the data to underscore this point. And we know that Black and Latino communities are also more likely to be located closer to fossil fuel emitting power plants, meaning that investment in clean energy production can reduce harmful health impacts. We need to ensure that there are mechanisms in place for not only homeowners to access these benefits, but renters as well. In Chapter 1 of the Latino Climate Justice Framework, we advocate for some of these solutions. And so some of that looks like we have to broaden access to clean energy and ensure renewable energy standards include programs like community-based energy projects, that they include microgrid projects, demand energy response incentives, which is something Lily just mentioned, and that they're coupled with that community solar programs accessible to renters are coupled with things like battery storage, energy efficiency options, and a comprehensive electric vehicle charging networks. And an example of this is the shared solar program in Los Angeles. I haven't yet seen something that is extremely robust, but I do think that we need to amplify more solutions and that the IRA money cannot just go toward homeowners. It needs to be accessible towards renters as well. Another thing I wanted to uplift is something that we cover in Chapter 3 of the Latino Climate Justice Framework, and that is around equitable access to public processes and language access. So we need to be able to increase community involvement in decision-making processes. And a lot of that has to do with how the programs are translated, how they're promoted, and who the validators are in the communities. And so I think this was mentioned by a couple of the speakers, but in order for there to be like true equity and accessibility, it's not enough just to have the information available for people who already are engaged in this, but we need to have, for example, promotora models where people go house to house in certain neighborhoods and are able to talk about the incentives in real tangible ways and what this means for their home, for their landlord, and how that's connected to their energy bill. And so those are things that I think there are programs out there. We just need to be able to connect the dots and expand the programming that is working to utilities across the country.
Irene, thank you. And thank you to each of you for joining us today and for this rich discussion. We are going to wrap this up. Thank you all. It is now my pleasure to introduce a special recorded conversation between Dr. Salas and the former first White House National Climate Advisor, Gina McCarthy. Thank you all.